All right, so you want to know how to deal with glasses complaints when the patient comes back after you prescribe them the glasses, right? So the first thing you need to do, it's easy. You just need to be empathetic. I know it's hard to do sometimes, especially when you've got a busy schedule, but you have to remember that chances are you're the one that probably made the mistake, and the patient just wants you to acknowledge their problem. So easiest thing to do is just make sure you're just you're asking the questions like, what specific area are you having a problem with? The things that you usually do in a regular exam, right? So now you're just comparing it with these glasses though. Is it just that they just feel weird? Is it they can't see up close? Is it they can't see far away? You just need to figure out the specific thing that's bothering them, and that makes it a lot easier for you to solve the problem. If you are not empathetic and you don't listen to them, and then you just randomly change something just to change something because maybe you're just you think they're over exaggerating, or you think it's not that big of a deal, they're probably going to come back again. So easiest way to handle these situations, just make sure you're being very empathetic to the patient with their problem so you can fix that need. All right. The second thing I will tell you to do is you need to, if they're coming back with the glasses because they can't see out of it for whatever reason, it doesn't even matter the reason. For me, what the first thing I'm going to tell, I would want them to do is to come back with their old glasses. So I need to compare and make sure that what the old glasses are, because chances are that's what they're comparing everything to, right? That's what they used to wear before. They didn't really have any problems. If they have problems, they expected you to fix those problems with the new glasses, and it's not doing that. So what were the old glasses doing, and what made them feel comfortable, right? Because chances are those those old glasses, even though they had a problem or if they didn't have a problem, that's another problem to deal with. But if they had a problem, you didn't meet that need, you need to know what the heck those old glasses were, so that way you can try to meet those needs, right? So if you changed their prescription, it's supposed to help them see far away, and it's not doing that, you need to know what the heck that they were in before, so that way you have a great understanding of what you are trying to get this patient to be able to see, or at least educate them on, okay? The third thing I would tell you is make sure you work with your store manager. That way there's no confusion with the patient, and then this helps build trust, right? And so when the patient comes to you, they complain about their glasses, you provide another solution for them. When you go do the handoff to an optician or the store manager, explaining what's going on in front of the patient with your store manager helps build that connection, right? So now not only do they trust you, but they trust who you're handing it off to, and it makes them feel more comfortable. If there is no trust, I can promise you could remake those glasses. That patient is going to come back already distrusting you. Is probably going to find another problem just because they didn't trust you in the first place. So you want to establish trust in this process. So be empathetic, compare to old glasses, and build trust throughout the whole process. And then if they come back for a third or fourth time, right, I will be honest with you. Chances are they're just looking to get their money back, okay? Don't make it so hard for them. If you are making it hard, sometimes people don't know how to tell you that it's not necessarily the glasses, they just want to get their money back. Could be for multiple reasons. Could be because they just need the money back, could be because they don't like your customer service, whatever. But sometimes people are not confrontational, and they keep trying to give you hints, and you're not getting it. So you keep remaking the glasses over and over again. All you're doing is losing money. You just remake it or just refund it and get it over with, right? And so you need to understand in those moments where that's what they're looking for. And then the second thing or last thing I'm going to tell you is how to avoid these problems in the future. You want to look at these patterns. And so look at patterns for like specific age brackets, right? And so if we're talking about 65 and up, well, not even 65 and up. Let's just say you're talking about 20 and up, right? So between 20 and 30, you're not really expecting a lot of changes in a prescription for anyone, even if they're very nearsighted, right? So if you're making changes, you should be questioning why you're making that change. They should have came in with a complaint saying they can't see. If they came in with no complaint saying of not being able to see, there's not much reason for you to be making a change. So if they're coming back and because you made a change when they didn't have a complaint, that's probably why they're coming back. Don't do that. That's first off, okay? But anyway, so if you want to avoid these problems, take consideration of their age, because that can give you the storyline of what you should expect a normal person to experience, right? So If if they're kids, they're around the age of 13, you're expecting change, right? Every year you're probably expecting change. But a 25-year-old, you're not expecting much change. A 30-year-old, you're not expecting much change. A 45-year-old, you're starting to expect some change. Does that change match what you're changing? Okay? So be very specific in that order. If it doesn't match, you need to do your due diligence to make sure that you are doing the correct thing for that patient, because sometimes people are out the spectrum, right? So we want to make sure we're doing it exactly to the individual that we're trying to help. Other things you need to look for is like, do they have cataracts? Do they have diabetes, right? Is their diabetes, their A1C high? Is it low? Because if it's high, their vision is going to probably fluctuate, right? Especially if they're double digits. So give them realistic expectations from their glasses. If they come in with A1C that's 10 or above and you change their prescription and you don't tell them anything, they're going to come back, right? If they get their A1C down, they're going to come back because now they can't see all those glasses that you gave to them and you didn't tell them anything. You need to give them realistic expectations. What I do is when that problem happens, if they're desperate for glasses, I educate them. I let them know, hey, this is only going to be a temporary fix. Don't get rid of your old glasses, because chances are if you start building the right habits, your eyes are going to go similar to baseline. And what is baseline? Their old glasses. Educate the patients, give them realistic expectations. If they have cataracts, and they're starting to develop, they're not going to be able to see like they did when they were 30 years old. Give them realistic expectations. Don't just change the prescription just to change it. And if you do, tell them if it's going to help them or not. If you change it and you realize it's pretty similar to the old glasses, but it's slightly different, and you just send them out, they're going to leave thinking that their problem is going to be fixed and they're going to be able to see better. That is not true. You need to give them realistic expectations. So if there's something that's preventing people from being able to see the way they are wanting to or expecting to, you need to help bring them back down and give them realistic expectations. If you do that, you will reduce the amount of remakes that you endure over your time as being an optometrist or an eye doctor. So be empathetic. Compared to the old glasses, the old glasses is the thing that you need the most, okay? If someone's coming back for a recheck, you need to get your team on board and be like, hey, make sure they have their old glasses, because that's what you're comparing to, because that is what they're comparing to. Even if they haven't even worn old glasses in like 2 weeks or a month, their experience is from those old glasses, and that is what they're comparing, because the old glasses didn't do it. So get those things so you can figure out what the heck is going on. Work with your team, build trust with the patient, refund when you need to refund, and give realistic expectations. If you just change stuff just to change stuff, they will be back looking for you to change more stuff, and you will keep doing remakes. So anyway, listen to what they're telling you, and that'll fix the problem. And then if you learned anything new, consider subscribing.